My name is Mary Alice Anacarico, Senior Vice President and System Chief Information Officer for Henry Ford Health System. I'd like to introduce to you the rationale around our implementation effort of EPIC at Henry Ford Health System and introduce to you some of the planned and achievable outcomes that will be illustrated as members of our team have further discussion with you. Henry Ford established a uniquely integrated health system model in 1915. It's the fourth largest employer in the Metro Detroit area with 29,000 employees, 5 hospitals, over 70 ambulatory facilities that include home health, retail, community care services, a large employed medical staff, and an integrated insurance plan. The revenues for Henry Ford Health System exceed $6 billion. The system facilities include a large academic hospital, Henry Ford Hospital, with 877 beds. There are 4 community hospitals that include an additional 1,528 beds that are comprised of Macomb, Clinton Township, Wyandotte, West Bloomfield, and Allegiance Health. The system also includes 3 behavioral health facilities, as well as greater than 75 sites, including our medical centers, outpatient surgery, urgent care, and emergency services. The Henry Ford Medical Group includes 1,200 members of our employed practices, as well as an equal number of affiliated non-employed physicians.
I'm Jeff Patterson. I'm the Vice President of Clinical Transformation and IT Integration for the Henry Ford Health System. And today I'm going to speak about our journey for return on investment for the use of technology to support clinical transformation. As we talk about return on investment, I want to focus on 3 key areas: information technology, our clinical technology transformation, and the improvements we've been able to achieve within our rev cycle. And then we'll go through the summary, which is the actual results that we've seen in our journey. So to start, our information technology journey was a result of an in-house developed application that we had for about 25 years that wouldn't scale up for meaningful use, ICD-10, and other requirements that were coming down. The health system launched what we called Project Helios, Henry Ford's electronic integrated information system. The project was leveraging EPIC as the foundational technology to really look at ourselves and transform and push towards standardization. The project was not IT-driven, but rather IT-enabled. It was really an operational and clinical transformation that had technology as a partner. All of the principles within our project were formalized into a system board-sponsored, formally written charter, which was the anchor of the project. Within the charter, there were expectations, goals, and outcomes defined. The mission statement of the project was that Henry Ford's system, Helios Initiative, would transform and integrate our business and clinical operations across the system. It was truly an opportunity for us to integrate across the health system and standardize. Through a standard approach and engaged workforce, Helios aligned with the mission, vision, and values of our health system. The investment into the technology change was intended to strengthen our commitment to improving people's lives through continuous improvement, commitment, and innovation. The Project Helios had really 3 key areas. The first and largest was the deployment of EPIC across our enterprise, and that included our inpatient and ambulatory facilities. We wanted to build and deploy a fully functional electronic data warehouse to allow us to take the data that was captured and transform it into information. The last piece was taking a recently purchased facility, Henry Ford Macomb, and transforming their technology from their former system to that of Henry Ford Standard. Project Helios has allowed Henry Ford to become a Stage 6 certified organization across inpatient and ambulatory, and we fully believe that we'll achieve Stage 7 within the next 18 months, with document scanning as our only remaining requirement. We've been a perennial Most Wired status winner with advanced status being designated for 2017. Project Helios also gave us the opportunity to deploy a standard methodology and framework as we acquired new facilities. Most recently, our Henry Ford Allegiance Hospital was brought live on our Epic platform with standard practices, policies, and procedures in August of 2017. When we started out to design what Project Helios would be, we wanted to leverage operations to drive what the ultimate deliverable needed to look like. We made the decision to adopt the core functionality within Epic in our inpatient, revenue cycle, and ambulatory areas automatically. But there are a lot of other applications, modules, and decisions to be made. So we launched a scope and timing task force to review the existing functionality that was outside of core, and then the feasibility of deploying it within the timelines that we had. The committee was chaired by our medical leader, the Chief Quality Officer of the organization, and focused on operational areas of improvement. We chose to adopt like-for-like functionality, which meant that if Epic had a commercially available mature product, we would choose that product as opposed to going with a third-party or best-of-breed solution. Truly, the overall impact was viewed in favor of individual areas of functionality. We couldn't always replace every bell and whistle, but we did want that integration that was offered by a standard platform. And a key component of this committee was that once a decision was made, they weren't revisited. So the project as defined was executed. The in-house developed application that was replaced by Epic required that we had a large presence of partner IT organizations, and that resulted in the outsourcing of the majority of our development. Through the standardization to Epic, we were able to focus on insourcing and ultimately brought in about 650 consultants to the organization and had a very high, greater than 98% retention rate. What that gave us was the opportunity to rebalance based on demand and skills. So as we looked at Epic and new tools and new transformation, we could repurpose people in a more effective way as they were part of the Henry Ford family. We also looked at our application portfolio and found that there was tremendous opportunity to consolidate. We didn't have a true electronic master patient index because each one of our facilities had their own registration functionality and systems. By bringing those things in, we were able to take a true EMPI and deploy it for those areas that weren't Epic. So when a patient presents, their encounter tracks through all applications. We were able to look at our departmental contracts and move them to standard terms and conditions at an enterprise level. Standardizing these terms and a migration pathway to Epic allowed a much more efficient support model post-live. We were able to take many legacy applications and standardize those to that of Epic. An example is we had over 25 systems that were considered revenue cycle, where a patient could be registered, a bill could be dropped, or some other function could be served. By moving to the Epic suite of revenue cycle applications, we standardized and could retire all of those 25. From an infrastructure perspective, we looked for the opportunities to virtualize when possible, and now we're over 80% virtual. Clinical and operational return on investment is often hard to define. Often it provides capacity, but with the shortages across nursing, ancillary services, and for physicians, often it's not in an FTE count. So we focused on efficiencies. Our transcription and dictation process was something that was heavily leveraged across all of our facilities. By standardizing the way that data was documented, either through voice recognition or through smart phrases and text within Epic, we were able to allow providers to enter data directly as opposed to having to wait for that information to be transcribed. The result was about $135,000 per month in savings and provided more immediate access to information as the physicians edited what they put into the record and didn't require someone else to transcribe. We also focused on areas of efficiency through electronic distribution of information. Our paper, postage, and processing had a significant cost, about $100,000 a month, that we were able to reduce because we leveraged tools that were in existence now because we were on Epic. Through the Care Everywhere platform, we were able to exchange 7.4 million records across all 50 states in 2016 alone. We're on track to exceed that and are on pace to exceed 8 million in 2017. And that doesn't include our recently live care equality platform that allows us to exchange with non-Epic platforms such as Cerner. We have a heavy adoption of MyChart, which we believe is a great patient engagement and data sharing tool. We have over 384,000 active accounts through August of 2017, and those are purposeful activations. Everyone who gets an after visit summary is provided a registration code, but the patient needs to go home and perform a registration to be included in that count. So these are active patients interacting with our system through the portal. It allows us to share appointment reminders, bills, and other things that would in the past have been mailed out. We're live on electronic prescribing, including Scheduled II medications, which allows a great reduction of prescription pad and other printing that otherwise would be required. And for our non-Epic providers, we have an EpiCare Link platform that allows data to be visualized online as opposed to the faxes and paper mailings that used to be required. Within our pharmacy, we standardized our formulary across our enterprise, going from about 13,000 medications to 3,500. What that allows is better volume purchasing and resulted in about an $83,000 per month savings perpetually. From an incentive program perspective, becoming standard on Epic allowed us to look at several areas of improvement. Two examples being the physician group incentive program. Our first opportunity after the enterprise was live doubled the amount received, and we had 0 opportunities for improvement. Across meaningful use stages 1 and 2 for our facilities and our providers, we've achieved greater than 98% of the available incentive in terms of reimbursement. A revenue cycle transformation is really multifaceted. Within the charter for Helios, we define targeted improvement expectations for net patient revenue, days in accounts receivable, and then within our business office, this gave us the opportunity to standardize and consolidate, whereas the non-standard systems held us back. We've been able to leverage our electronic data warehouse to provide visibility into bottlenecks, areas of improvement that could be easily found, and then process flowed to prevent them in the future. We've leveraged Epic to improve documentation and available data for workflow visibility. We don't view RevCycle outside of our clinical environment, but rather a partnership between what's documented by the clinicians and how it presents to the patient statement. We were able to create a central business office to manage all of our revenue cycle functions for the system. This took revenue cycle from each facility and centralized it. This provides significantly improved reporting and visibility to revenue cycle across the board, which allows us to realign staff as rework was minimized. We consolidated all 5 of our clinical documentation improvement programs to a standard one, so information could be shared from one facility to another in a much more seamless way. And then post-implementation, we've developed an annual rolling revenue cycle playbook that allows us to address productivity and revenue cycle opportunities to gain. Examples of benefits from the revenue cycle improvement would include a $25.7 million improvement in 2015 over the 2014 baseline. We held that gain and achieved an additional $34.8 million in 2016. And in 2017, we'll again expect a revenue gain of $20 additional million. Through July, we're on track to achieve $31.5 million, well exceeding our $20 million goal. This is within the first 2.5 years of the full system being live on Epic. When you accumulate the benefits and project through the end of 2017, we will eclipse $166 million in revenue cycle improvements since we had our last facility go live. The revenue cycle playbook is really a collection of initiatives that are intended to achieve a measure. So those measures are represented in what we call our banner goals. So for 2017, our banner goals are hospital billing days and accounts receivable of 43, professional billing days and accounts receivable of 34, an initial claim denial rate of 8% or less, and an overall denial write-off of 1% or less. Each one of those banner goals has areas that are assigned out to certain teams. A revenue integrity team, coding and documentation, transaction management, patient pay, and then the last area was our newly live Henry Ford Allegiance Hospital in total. Each one of those areas, by putting in programs to improve the banner goals, has a translated dollar value that they've achieved. And as you'll see on the graph, we are exceeding in every one of those areas the goal for the year. So the summary slide of what we've been able to realize through the end of 2016, the information technology alignment, insourcing, virtualizing of servers, and application standardization has netted us a result of about $38.3 million. The transcription savings month over month has resulted about $5.7 million in savings. The forms copying, cost reductions, printing, postage has net about $6 million in savings. The drug cost, by standardizing our formulary, over $3 million in savings. And then the revenue cycle optimization from the previous slide shows an $86.2 million savings. When we talk about reimbursement and incentives, you'll see there's a $69 million achievement that we've realized. The result is about a $208 million return on investment through 2016. What's exciting as well is that we're on track by the end of 2017 to achieve a return on investment that will cover the 3 stages of Project Helios. The cost of converting the system to Epic, the cost of migrating to an enterprise data warehouse, and the cost of standardizing Henry Ford Macomb Hospital to that of Henry Ford's standard applications. The other thing we're able to show, and you'll see this in the last column, goal mapping, is that the goals that were set within our initial charter have been realized directly by these areas. So we consider the project certainly a success and are very proud of the return on investment that we've been able to document. So I thank you very much for letting me share the Henry Ford Health System return on investment journey, and I hope you have a good day.